Did you know that stress can be a problem with diabetes? We're going to talk about that. If you like what you see here, please consider subscribing. Hello, let's talk about an important topic today. Let's talk about stress, particularly as it relates to managing our blood sugar. For those of us who are diabetic or have struggled with insulin resistance in any form, pre-diabetes, anything of that nature. Let's talk about stress because it's a very, very important topic. Again, I never want to complicate matters here. I'm hoping, in fact, that it'll help simplify matters, simplify your life, and uh, perhaps simplify your understanding of my channel to some degree. You know, I'd put out a question to my subscribers a video or two ago. Did an update. The title of the video, I believe, was Update on the Channel or Channel Update with questions for my subscribers. And one of the questions I asked was whether I should make a new channel, a separate channel that includes little day trips and things that my wife and I do, and or whether I could just keep it all on the same channel. And 100% of my subscribers who responded said that they would prefer to just keep it all on one channel. And I was really happy about that. And I'm hoping in some ways this video will tie all these concepts together, because to me, they all go together. Stress reduction helps better manage diabetes. So at any rate, let's talk about stress. I'm talking about long-term unhealthy stress. Stress on, or emphasis on, the long-term part of that, because everybody experiences short-term stress. Like if you're, and that doesn't do you any long-term harm or anything to experience those types of short-term stress, but the long-term stress from a stressful career or stressful living conditions or stressful health problems, anything that's long-term and chronic, that can create some other health issues in and of itself. For type 2, I'm speaking mainly here about type 2 diabetes. I'm sure it's a factor for type 1 also, but I hardly ever speak to type 1 diabetes. I'm primarily telling my own story, and that's about type 2 diabetes. With stress, there's a hormone called cortisol that is raised, and when cortisol is elevated, that gives us that raises our blood sugar. And so there is a natural thing there where cortisol will rise in the morning. What about if you're under undue stress, unnecessary stress, if you will, on a long-term basis? Some of the consequences of long-term unnecessary stress can be depression, anxiety, burnout. You hear people talk about being burned out with their job, and they may have a great job. They may have a wonderful job. It could be a school teacher, a nurse, a doctor, but sometimes they get burned out, and the stress can cause that. And long-term stress can cause heart disease, high blood pressure, abnormal heart rhythms, heart attack, stroke. Heart attack and stroke, are things that diabetics worry about anyway. If your blood sugar's out of control, that can happen. But stress can also cause heart attacks and strokes. And so you don't want blood sugar problems and stress, one feeding the other. You don't want that vicious cycle of stress and high blood sugar ruining your health and ruining your life. Long-term stress can cause obesity and other eating problems. For women, it can cause problems with their menstrual cycle. Again, this is stress, long-term stress. It can cause skin and hair problems like acne, psoriasis, eczema. It can cause GI tract problems like ulcerative colitis, irritable colon. And there are even studies that indicate that long-term stress can lead to cancer. So stress is an important thing to take a look at. Again, I'm not trying to make anything more complicated at all. I'm just saying that reducing, if you can find nice, simple ways to reduce stress, um, if you're on a program of health for the past 20 months, I've been trying to live my best life in terms of health, and I've made enormous improvements. Number one, by just reducing carbohydrate intake, treating carbohydrates like it's something that I'm allergic to and that's something that'll kill me. Just concentrating on carbohydrates for that first 4 to 6 months improved my health immensely, immensely. That was the most important thing. And to reduce carbohydrates, I ate keto and also did some intermittent fasting and all. So that was the most important thing I did. And then along the way, I started watching what kind of fats intake I take in and making sure I don't do any vegetable oils, which should be called seed oils, and went with natural fats rather than what's called vegetable oils, vegetable fats. It's really seed oils, seed fats, and they're toxic and not fit for human consumption, in my opinion. Also, long-term stress can interrupt our sleep, and sleep is so important for our health. I don't think I have to convince anybody of that. I think everyone knows that you can't do that. Now, sometimes in order to deal with stress, people make some bad choices for ways to deal with stress. And some of those are smoking, like cigarette smoking, smoking in general. That's one of the worst things you can do for your health overall. If you look at all the things, with almost any condition, like when we talk to patients in our office about macular degeneration, one of the first things we do is ask if they're smokers. And if they are, we tell them, do whatever it takes to stop smoking. And now I talk to them about what kind of oils that they use, what they cook with, whether they use margarine or butter. I tell them not to use margarine. I steer them away from all the seed oils because in recent weeks here, I've learned that all those seed oils, I knew they were, for a long time, I knew that they could cause inflammation and that they were bad, but it's only recently that I've learned they could be a cause or a contributing factor to macular degeneration. So when I'm dealing with people about macular degeneration, I ask them those questions about whether they smoke, and if they do, they really need to stop that. And that's just even if they have a family history of macular degeneration. And I also add to that now to get rid of any vegetable or seed oils. And then another mistake or bad life choice that some people make to relieve stress is excessive alcohol use and as a stress reliever. You read all the time that small, amounts of alcohol, 1 drink for women, 2 drinks for men or something a day is not that harmful and could even be good. Like they say, red wine is healthy as long as you don't do too much of it. But if people are under a great deal of stress, if they're burned out with their jobs and stuff, sometimes people will abuse alcohol, and that's a bad health choice to make. So what kind of things do I try to do to relieve stress? One thing that I've really concentrated on here the past few months, we've got this COVID-19 going on and all kinds of unrest. Watching the news is a very stressful thing. I try to stay up to date on news. A lot of times I'll try to get updates on COVID-19 online where I can just briefly read it and see if there's any new regulations in place and what the numbers are, how many active cases there are, how many deaths, see what the trend lines are, whether it's going up or coming down or plateaued. But I have stopped watching TV news almost completely. That I'm convinced now that is not healthy. For one thing, you find yourself worried and stressed over things that you have absolutely no control over. And I'm not doing that anymore. I'm not doing that at all anymore. Now in my office, I have to be sure, like with COVID-19, that we're following all the current guidelines. But again, I can find that information online with a quick 5 or 10 minute read. I don't have to sit and listen to hours worth of one of the news networks, these news networks that go 24/7. And I've heard that suicide rates are up recently. Is it any wonder with all the negativity that's out there? I don't need that kind of stress in my life. So, and then another thing that my wife and I really enjoy doing as a stress reliever, whether people like it or not, is we enjoy escaping the rat race of the big city of Dallas. My office is in Dallas, and we live in a suburb of Dallas. Um, and we enjoy going out to smaller towns in Texas, and we're very careful. Look at my video called Travel, Am I Crazy? We are extremely careful when we go out to these smaller areas that we're not bringing stuff with us. We've got gloves and masks, and we're taking all the precautions that I take in my own office when I'm face to face with patients. We take all those same precautions when we go to these small towns and make sure that we're protecting ourselves, and even probably more important, that we're protecting them from us. Since we're coming from the big city to the small town, we're extremely careful. But I can't begin to tell you what a stress relief it is for me and for us together. We usually take our little dog with us, and it's just almost like a mini vacation. But we don't spend the night. We go in the morning, we come home later in the afternoon. But that's a big stress reliever for us, and it's not something that I plan to give up. And I've put a few videos out there of some of these little trips we've taken. Some of them were just compilations of pictures from trips that we had taken prior to all this virus stuff. But we had pictures before I knew I was going to even have a YouTube channel, and I posted those, and it seems like nobody wants to watch them, and that's fine. That's fine. But on my channel, I'm going to tell my story, and that stress reduction technique of escaping the madness of the big city and going out and getting some fresh air and sunshine. So I'm working in a small, dark room 40 hours a week, 5 days a week. So for me to go out and get some sunshine and some fresh air, riding in a boat on the lake, or sitting outside next to a lake with our own chairs that we brought with us, our own lawn chairs that we brought with us, and often our own food and something to drink that we brought with us. You're going to have to explain to me why that's a bad thing. In my mind, that's a very, very healthy thing, and it's definitely a stress reliever. So that's something I'm going to keep doing, and I'll probably keep posting videos about it. And people can ignore them if they don't like that. If that's seems like the wrong thing to do. Everyone's entitled to their opinion, and I won't argue with you about it. But I know for me that stress is a killer. I think stress is a killer for everybody. Now, how you deal with it is up to you. And turning off the news, turn off the news, turn off the news, turn off the news. For me, turning off the news is important, and just trying to avoid all the negativity that's around us right now, and then escaping the big city for small towns with friendly people is very healthy, and I'm going to continue to do that. So thank you for listening to this little discussion of stress and how it affects us in keeping our blood sugar under control. And I'll just end by saying, live healthy and finish strong. Thank you very much. If you'd be so kind, please consider subscribing. Thank you. I really appreciate it. And none of this is intended to be medical advice, as always.